Hi, and welcome to the podcast series Proctology and Laparoscopic Surgery. This is Dr. Ranjan Tripathy, Proctologist and Laparoscopic Surgeon with you. Today in this episode, I'll try to highlight the chances of hernia reoccurrence after a primary surgery. That is an answer to the question which is commonly asked by the patients, that will my hernia come back again after the operation? After hernia surgery, hernia recurrence rates vary a lot, and many studies suggest that 90 to 99% success rates are common. When compared to non-mesh repairs, in many cases, mesh repairs offer a smaller chance of hernia recurrence rate. Unfortunately, some hernia repairs may lead to a very high incidence of chronic pain, which can range from 5 to 15%. The main objective is to find a surgeon who has performed a lot of hernia surgeries. Typically, an experienced surgeon will have better results with or without the use of mesh, saying that there is no one-size-fits-all approach to hernia surgery, and it all depends on the surgeon who decides what approach fits for an individual. So, let us understand two important factors as to what is recurrent hernia and what are the risk factors for developing a recurrent hernia after a primary repair. One of the important risks associated with hernia repair surgery is that any hernia can return after a successful surgery. A recurrent hernia is a process where a hernia repair fails and the hernia reappears. So what are the symptoms of a recurrent hernia? A recurrent hernia is often recognized as a bulge, sometimes painful, that appears at or near the site of the original hernia. Severe health complications occur if the hernia progresses and the intestines protrude into the hernia, such as infection, constipation, nausea, vomiting, and in extreme cases, loss of blood supply and strangulation of the intestines. Now, why do the hernias recur? Or what are the causes of recurrent hernias? There are a variety of reasons for a hernia to reappear, some of which may not always be clear. The following factors can place patients at an increased risk of recurrent hernia, like infection of a wound from initial hernia surgery, being too active too soon after surgery, chronic use of steroids, chronic cough, smoking, and obesity. Usually the risk factors for developing a recurrent hernia can be categorized as surgeon-related factors and patient-related factors. In surgeon-related factors, usually an inexperienced hernia surgeon who has conducted less number of surgeries is more likely to do an ineffective repair and leading to a recurrence of hernia. Surgical inexperience of the initial surgeon, like I said, can lead to recurrence. Open hernia surgeries usually performed under local anesthesias are more likely to recur. Insufficient surgical technique of the surgeon, like lack of adequate mesh overlap during the primary repair, improper mesh choice, and lack of proper mesh fixation, contribute technically to recurrence of hernia. Many patient factors like presence of a sliding hernia, collagen disorders, obesity, steroid abuse, and like I said, being too active too soon after surgery, smoking, chronic cough, and non-mesh repairs done during the primary operations are usually, these patients are at increased risk of having a recurrence after hernia surgery. It's very important to understand that presentation of hernia at the time of surgery is also a risk factor for recurrence, like larger hernias, emergency hernia surgery, etc. have increased risk of recurrence than the normal elective surgeries. So what do we do when we have a recurrent hernia? Surgical intervention is again very necessary in order to repair a recurrent hernia. It can be one of the most challenging types of hernias to repair. Usually, individuals with a recurrent hernia are good candidates for laparoscopic repair because the muscles of the abdomen are weak and laparoscopic surgical techniques is useful to maintain the integrity of muscles more so than an open hernia repair procedure. Also, scar tissue from the previous surgery can be avoided when using laparoscopic techniques. Open repair may be necessary if the recurrent hernia is complex in order to properly restore the functionality of the abdominal wall. Open hernia repairs allow surgeons to carefully move abdominal tissues to their original position and place mesh on both sides of the weakened muscle in order to provide additional reinforcement. However, the type of hernia repair needed for a recurrent hernia repair is to be decided on case-to-case basis, taking both the patient and the hernia factors into account. To conclude, I would like to say that there are certain factors responsible for recurrent hernia, but the latest technology and experience of your operating surgeon reduces the risk of recurrent hernia after a primary hernia repair. Thank you for listening to the podcast patiently. We'll be back soon with another new surgical episode. This is Dr. Ranjan Tripathy signing off.